Last century, we got good at making drugs. In the 1940s, we began manufacturing antibiotics to treat infections from pathogenic bacteria. The drugs were simple and effective. They reduced the impact of what were then deadly diseases, such as pneumonia or tuberculosis. But, just as Alexander Fleming predicted, the ability of antibiotics to fight bacteria diminished through time. The inevitable forces of evolution acted as a filter to find the variants with natural resistance, and then give them ecological space to thrive and replicate. My interest as an evolutionary biologist is to try and apply our understanding of evolution and genetics to protect and develop our precious medicines. Let me tell you more. This is ASU. An exciting but controversial line of research is exploring whether we should treat organisms or pathogens with a hit fast and hard approach, or whether it would be better to reduce the drug dose and therefore the selective pressure. We have traditionally been told to make sure you take your full prescribed dose of antibiotics, or else you could be responsible for resistance evolution. Now, some evidence is coming out that might in fact not be true in some situations. The idea behind this is as follows. Many resistant mutants pay a price for being resistant. It serves them well if there are drugs or insecticides around, but in their absence, they might not grow as well as their susceptible counterparts. We call this a fitness cost. One way to think about a fitness cost is to think of a knight in shining armor. On the battlefield, that armor greatly protects him or her from attacking swords. However, outside of combat, wearing this armor comes with a cost. It can greatly reduce the vision, and it's very heavy and hot. When an organism has a genetic mutation that makes them resistant to a drug, they don't have the luxury of armor that they can put on and take off when it suits them. They have to live with that mutation, whether there are drugs around or not. When there are many of those more susceptible counterparts around, these resistant mutants may have a hard time increasing in numbers because of this fitness cost. However, when drugs are around and the majority of those competitors are killed, the resistant ones are able to grow to high numbers. So, if we want to keep the resistant organisms small in number, perhaps we should keep some of these susceptible competitors around. One way to do that might be by not giving this high aggressive dose of drugs, but a smaller dose that would control the infection but leave enough susceptible competitors to outcompete the resistant ones. We tested this principle using a rodent malaria model. We infected mice with both susceptible malaria parasites and added a few resistant ones to mimic a situation where resistant mutants are rare. When those mice were not treated with drugs, we rarely saw those resistant parasites again. But when we gave a very high curative drug dose, we cleared the susceptible parasites, which then allowed the resistant parasites to grow to large numbers too. The less drugs we gave, the less of an advantage we gave to the resistant parasites. The treatment of cancer faces a similar problem. Resistant cells are suppressed by susceptible cells, but as soon as you wipe out the susceptible cells, the resistant ones grow to high numbers, which might ultimately lead to an untreatable tumor. A pilot clinical trial of metastatic prostate cancer, which gave only enough chemotherapy as was necessary to control the growth of the tumor, but not intended to eradicate it, was very successful in prolonging the time to cancer progression. Plus, it had the added benefit of less chemotherapy for the patient. Now, you should always follow your doctor's advice. The research is too young yet to make it a good idea for you to only take half the course of your medication. But in the future, we might just adjust the dose. So, if we are to address the decline in antibiotic efficacy, we must understand this area of evolution quickly. Our ability to treat minor infections and to mitigate the inadvertent development of new and more challenging pathogens rests on this area of research. The use of antibiotics fundamentally changed healthcare in the 20th century. The loss of them from our medical arsenal would be a catastrophic step backwards. Let's make sure that that doesn't happen. This was ASU. Thanks for watching.